Hello, my name is Grace Pratt, and I decided to do my final project on Addison's disease. So, Addison's disease is essentially an adrenal insufficiency. So, this means that three different types of hormones are not being produced, or not enough of them are being produced to maintain homeostasis. So, the first hormone that is not being produced is cortisol. Cortisol is released during stress, and it's involved in raising blood glucose and inhibiting the inflammatory response. Aldosterone is also not being produced. Aldosterone regulates both sodium and water retention, which in turn regulates blood pressure and fluid balance in the body. Lastly, androgens are not being produced, and androgens are converted to testosterone and estrogen. So, this is some of the etiology and risk factors that contribute to Addison's disease. 80% of cases are caused by an autoimmune response. So the body is attacking its own adrenal glands. This disease can be common with other endocrine problems. So if you, as a nurse, know that your patient already has some endocrine problems going on, you would definitely want to assess for Addison's disease. This is not as common in the US, but Addison's can be a complication of tuberculosis. So, like I said, in the US, we've essentially eradicated tuberculosis, so this would be very rare. But in developing countries, this is definitely still a major cause of Addison's. Another cause is damage to the pituitary gland, and the pituitary gland releases ACTH, which contributes to the release of the three hormones that I mentioned before. So if you have damage to the pituitary gland, ACTH is not being released, which again affects the three that I just mentioned. So another one is abrupt withdrawal of steroids after long-term use. So if a patient is on steroids for another condition, the body sort of stops naturally producing the aldosterone or the cortisol. So if you abruptly stop, your body is not going to get the signal to start producing them again. So if you have a patient that's on steroids and they're able to go off of them, you would want to make sure that you taper the dose so they don't have the risk for Addison's disease. Some other factors that could contribute to Addison's are AIDS, metastatic cancer, and chemotherapy. But again, the most common cause is an autoimmune disease. So these are some of the signs and symptoms of Addison's disease. Typically, patients have a slow onset of symptoms. They won't really notice anything severe until the disease has progressed. They can have hypoglycemia, and this is due to the lack of gluconeogenesis happening in the body. And gluconeogenesis is when the body uses proteins and fats as a sort of source of glucose. Hyperpigmentation can occur. The patient will look pretty orange or bronze. It'll look a little bit unnatural, not like a normal tan that you would get in the sun. They can have impaired coping with stress, dehydration due to that lack of aldosterone, loss of pubic hair, which is the loss of androgens, weight loss. They can have a lack of appetite, which contributes to that. Women can have amenorrhea and other menstrual changes, and they'll just have an overall sense of weakness, fatigue, lethargy, and they will have joint pain and muscle pain. They can also be depressed or irritable. So a nurse would obviously want to do or would want to obtain a history during their assessment. So you would ask the patient if they have a family history of autoimmune disorders, because that can be a risk factor for Addison's. You would ask about their surgical history. Have they had any sort of surgery near their adrenal gland that maybe it got damaged? Steroid use, because again, maybe they stopped abruptly and that's contributing to their Addison's disease. Again, in the US, this is not as common, but you would want to ask if they have a previous fungal infection or tuberculosis, or if they've been to a country where tuberculosis is more common. And then you would also see if they have cancer or are receiving chemotherapy. And then these are just some of the observable signs and symptoms. They, like I mentioned before, they will have a bronze or orange skin pigmentation. which is seen in the woman to the right. She definitely looks a little bit orange, and it just kind of looks unnatural. Um, you would ask the patient about their fatigue and weakness and muscle pain and joint pain. You would ask about nausea and vomiting and see how long that's been going on. It usually will be happening for long periods of time. You would ask or look in their chart to see if they've had an unintentional weight loss recently. You would palpate their joints and their muscles and assess their pain. And then you would assess their overall mood. Are they irritable, anxious? How are their coping skills? And then this is another symptom that can occur in patients with severe Addison's disease. So this Addisonian crisis is triggered by severe stress, fever, surgery, or severe dehydration, and symptoms will worsen very quickly. So if it's left untreated, it can lead to seizures, shock, coma, and death. So basically, this is if a person has severe Addison's and it's not being treated at all. If they have something stressful going on in their life or something traumatic happen to their body, like a big surgery, or they are severely dehydrated, their body can just sort of go into shock. And yeah, like I said, it can lead to seizures and even death. So the main pharmacologic treatment for Addison's disease is corticosteroids, and they're used to replace aldosterone and cortisol. So this would, increase their blood glucose, increase their blood pressure, increase their ability to cope with stress. Basically, it would fix all the things that they're lacking due to their lack of hormones. These corticosteroids do have a significant amount of adverse effects. Patients report having GI disturbances. It does increase blood glucose, which can be beneficial if they're having hypoglycemia, but you would also want to monitor for hyperglycemia. They can have an increased appetite, which is a good thing, but you would also want to make sure that they're eating a healthy diet and not overeating, because that can contribute to a weight gain. It causes water and sodium retention, which again is beneficial, but in excess, this could cause fluid volume overload or hypernatremia. It can cause delayed wound healing, osteoporosis, cataracts, mood swings, and just a decrease in immunity. They're more at risk for infection when they're on corticosteroids. So these are the main 3 drugs that are used to treat Addison's disease. The first one is hydrocortisone, or Cortef is the brand name. And the route is usually PO. There's also prednisone, which can be given PO, intramuscular, or intravenously. And then there's methylprednisolone, which has the same routes, the PO, IM, or IV. And these all have the same function. Really, the physician will just see which one works for their patient specifically. It's pretty individualized with the dosage and the medication, but they all have essentially the same method of action. It's really just replacing that cortisol and aldosterone. So whenever a patient is on corticosteroids, they need a significant amount of education, just because there are those adverse effects, and there's a lot that goes into taking steroids. So they're typically taken once daily in the morning with food to reduce irritation. Again, it depends on the dosage and the patient. Sometimes it might be 2 to 3 times a day, but always with food. I mentioned this before, but you would need to let them know that stopping this drug abruptly is very dangerous, and it could contribute to that Addisonian crisis. You would educate about the risk of osteoporosis. So it's important to encourage increased calcium and vitamin D and weight-bearing exercise. You would also want to educate on the infection risk and ways to decrease risk. So this is just basic things like encourage hand washing, make sure they have adequate food preparation, etc. And just let them know that they are at a more significant risk for infection. And then you would also want to let them know that their blood glucose should be monitored and that it can fluctuate. And you would especially want to educate a patient if they already have diabetes, because type 1 diabetes is an autoimmune disorder. So, it could possibly go hand in hand with the Addison's disease. So you would definitely want to let them know that their blood glucose needs to be monitored. So some nursing implications if you have a patient in the hospital that is on corticosteroids. You would want to monitor for signs of infection. You would, of course, want to monitor their blood glucose, like I said, especially if they already have diabetes. You would want to monitor their weight because they are having that fluid retention and also that increased appetite, but especially the fluid retention. You would want to do daily weights probably just to make sure that they're not retaining too much fluid. You would want to monitor eyes and nose because they are having that fluid retention. Monitor blood pressure just because it is increasing their blood pressure, which is a good thing, but in some patients it could get too high and they could be hypertensive. And then you would, of course, want to encourage weight-bearing activity while they're in the hospital, just because they are at risk for the osteoporosis. And then I don't have it on here, but you would want to monitor their electrolytes as well, just because you are messing with their sodium levels. So they could be, if they're retaining too much fluid, they could have hyponatremia, things like that. You would just want to look for the signs and symptoms and possibly get their electrolyte levels. And then some non-pharmacologic therapy. Really, the only known treatment for Addison's disease is that hormone replacement with the corticosteroids. So there really isn't anything that a patient can do without the medicine to really fix this disease, just because it is autoimmune. But you can add some complementary therapies that can help go along with the steroid use. So the first one is stress management. Patients can enter Addisonian crisis in times of severe stress. So you can educate patients on ways to reduce stress, some of these being meditation, breathing exercises, getting enough sleep, exercising, maybe going to therapy if they're really struggling, and possibly anti-anxiety medications if necessary. Obviously, that would be up to a physician, but these are just some good ways to manage stress and just reduce the symptoms that they're having from Addison's disease. You'd want to educate them on the importance of a healthy diet. Corticosteroids can increase blood glucose and appetite. So you would want to educate them on the importance of eating whole foods and adequate servings of carbs, fruits, vegetables, etc. A high sodium diet can actually be beneficial. Without aldosterone, sodium is not retained as well by the kidneys. So if a patient is on steroids, but their sodium levels are still pretty low, you can encourage a high sodium diet. You would want to make sure that they're consuming adequate amounts of calcium and vitamin D. And then also, you don't want them to consume too much potassium because people with Addison's disease are at risk for hyperkalemia if they consume too much. And then you really just want them to adopt a healthy lifestyle. Like I said, 150 minutes of exercise per week minimum, at least 6 hours of sleep, probably 6 to 8. Stay hydrated, maintain healthy weight, stay up to date with physicals, and make sure they're going to the doctor and just managing stress. There really isn't many non-pharmacologic treatments. I struggled to find some that were actually in practice. These were really the only things, just maintaining a healthy lifestyle while being treated with the corticosteroids. So some cultural context for the disease. Like I mentioned before, Addison's disease can be a complication of a prior tuberculosis infection. This doesn't happen in the US typically, it's pretty rare, but in developing countries, this is still a common issue. So the nurse should just keep this in the back of their head. Just be aware that if a patient comes from a developing country, they could have had TB, or if they've recently traveled to a developing country and you suspect that they've had an infection, you just want to be aware of this. The next one, a common defining symptom of Addison's disease is that hyperpigmentation, and this can be harder to recognize in patients with darker complexions. Like in this picture here, I know for me it was pretty hard to recognize that she's having that hyperpigmentation, just because she appears to be to have a darker complexion. So you would just want to make sure that you check the oral mucosa, the sclera of her eyes, her hands, I guess, just her skin everywhere. But it definitely is not as noticeable. So this would just be an ethnic consideration that the nurse needs to keep in mind and just be aware of. They might need to have a little bit more of an assessment on these patients. And then the spiritual context, I struggled to find this as well, but certain religions, such as Jehovah's Witnesses and other ones, are against the use of modern medicine. So the nurse should educate on the risks that accompany this decision, the major risk being the Addisonian crisis, which can lead to death. But the nurse should ultimately be respectful of the patient and family's decision regarding hormone therapy. You know, if they don't want to pursue hormone therapy, then really educate them on living a healthy lifestyle, managing their stress, you know, having that healthy diet, just being as healthy as they can be, because while it won't take away their symptoms and it's definitely not improving that hormone imbalance, it can decrease their risk for that Addisonian crisis. So yeah, that is it as my presentation. These are my references, and thank you for watching.